Good afternoon. My name is Leilani Prez, and I'm an analyst with the LEA BOP Provider Relations Unit. We will now get started with our afternoon session. Please note that we will be only using the Q&A feature and not the chat to submit questions for today's quarterly meeting. This will help streamline where questions go throughout the quarterly meeting. To use the Q&A feature, click the chat bubble icon containing a question mark on your toolbar, as shown in the top right image of this slide. A window will open on the right side where you can type your questions. Before you submit questions, please ensure that Ask a Question is selected in the drop-down menu to mark your post as a question, as shown by the second image on the bottom right corner of the slide. When DHCS responds to a question in the Q&A, it will look like the image at the bottom left of the slide showing the DHCS member's response and a check mark indicating the question has been answered. Once again, we will only be using the Q&A feature to respond to questions, and answers submitted through the chat will not be addressed. It is important to ensure your question is being asked through the Q&A feature to make sure that it is seen. However, if you are having any technical difficulties with the Q&A feature, please let us know in the chat. We have a lot of content to cover today, and the Q&A will be monitored by DHCS to answer your questions as they come in. If we are unable to answer your questions, we will either get back to you or add them to our next quarterly meeting. In addition, if your questions are not addressed during today's meeting, please send them to the LEA inbox at lea@dhcs.ca.gov. Furthermore, DHCS will share important links and further resources in the chat after the session is complete. Live captions are available for anyone who needs them. The image on this slide highlights the steps to enable live captions with arrows pointing to each option in Teams. To turn on captions, click the More icon in your Teams toolbar, select Language and Speech, and then show Live Captions. Captions will appear in the bottom panel of the meeting. A live transcript is also available for those who may need it. The image on this slide highlights the steps to enable live transcription with arrows pointing to each option in Teams. To turn on the transcript, click the More icon in your Teams toolbar, select Record and Transcribe, and then choose Show Transcript. The transcript will appear in the right side panel of the meeting. The quarterly meeting trainings are recorded and posted on the LEA BOP website for reference in the future, so speaker notes and the recorded transcripts are not provided. AI is allowed in public DHCS meetings, so you may use that to support taking notes during the meeting. Lastly, please feel free to have your camera on or off during this meeting. On this slide, there is an image of what the listserv webpage looks like on the right side of the screen, where you can fill in your name and email address, and then hit the subscribe button. DHCS communicates through the LEA BOP listserv regarding important program information, including upcoming meetings, program policy updates, and reminders. Please sign up today if you haven't already. You may subscribe and unsubscribe to the listserv using the subscription link found on this slide. Please do not email the LEA inbox to sign up for the listserv or request to sign up another employee. We cannot subscribe or unsubscribe for you. Instead, use the link on the LEA BOP homepage to sign up. Also, to ensure slides and materials are available before each session, reminders are sent a couple of days in advance on the day of the meeting. Slides are distributed through the LEA BOP listserv, making subscription essential for timely access to materials. And lastly, before we jump in, just a quick reminder that slides were sent out through the listserv this morning. If you're not already subscribed, you can join the LEA BOP listserv that I was just describing to get future e-blasts with the link. Also, we dropped a Google link in the meeting chat to get the slides. Once again, we encourage you to subscribe to the LEA BOP listserv to receive slides in a timely manner prior to future quarterly meetings. In addition, when subscribing to the listserv, you will be notified when QM materials are posted to the LEA BOP webpage. Today, we will be diving into the topic of random moment time study moments. Here's our agenda for today's meeting. First, we will be providing a brief refresher of the random moment time study, also known as RMTS, to set the level for this session. Second, we will discuss best practices for moment responses and the importance of these best practices. Finally, we will dive into documentation requirements for RMTS to help your LEA be prepared for audits. The goals of today's meeting are to know why RMTS moments matter and learn best practices for moment responses, learn the difference between direct service and administrative activity documentation requirements, and finally, understand the importance of documenting RMTS moments and know how to gather supporting documentation for audit purposes. Maintaining supporting documentation helps reduce potential negative audit findings and helps your LEA have everything in place to receive their earned federal funding. As a reminder, we will now refer to the Local Educational Consortium, or LEC, as the RMTS Administrative Unit, or RMTS AU for short, in alignment with the new Time Study Implementation Plan. This adjustment in language is because while each LEC independently coordinates the School-Based Medi-Cal Administrative Activities, or SMA program, not every LEC independently administers the RMTS, as some LECs operate as a joint RMTS or share responsibilities. As such, when discussing RMTS roles, responsibilities, and requirements, it is important to be clear as to which function or role we are referring to. Throughout this session, you will see words bolded in orange. Those in orange represent new information to reflect the proposed changes for RMTS in the Time Study Implementation Plan, TSIP, that is currently pending CMS approval. Additionally, we wanted to share a list of commonly used acronyms that we'll be referencing throughout the session, including Direct Medical Services Percentage, or DMSP, RMTS AU, or Random Moment Time Study Administrative Unit, and TSIP, Time Study Implementation Plan. As there will be many acronyms used throughout the session, we recommend having the acronyms PDF that was provided along the slides with you during this session for reference. I will now hand it over to Phoebe for the first section.
Thank you, Leilani. Hi, everyone. My name is Phoebe Lamb, and I'm with the LEA Providers Relations Unit. So now that we've introduced the agenda and goals for this session, let's go over a brief refresher of RMTS before jumping into the best practices for moment responses and documentation. Starting with the basics, this graphic illustrates the oversight of the school-based Medicaid programs, including how RMTS fits into this. Starting at the top, CMS is a federal oversight agency that oversees all state Medicaid agencies, including DHCS in its programs, as DHCS is California's state Medicaid agency and has oversight over Medi-Cal, which is the name for Medicaid in California. Under DHCS, oversight is split between two separate programs, the SMA program, which oversees all administrative school-based claiming, and LEA BOP, which oversees all direct medical service claiming. Under the SMA program, local educational consortia, or LECs, contract with DHCS to oversee their region's LEA's participation in SMA. The LECs also serve the role of administering the RMTS. For ESMA, they do this in the context of their ESMA/LEC contract. Under the LEA BOP, LEAs directly contract with DHCS to participate. As you can see, there is a dotted line between the RMTS administrative unit on the left and the LEA on the right. This dotted line is used to illustrate that while LEAs are not overseen by RMTS administrative units under the LEA BOP, RMTS administrative units administer their region's RMTS, which is used to inform cost allocation for the LEA BOP. Briefly looking over RMTS, it is not considered a standalone program. It is a federally approved, statistically valid methodology used by the LEA BOP and ESMA program to document the proportion of time staff spend on Medicaid reimbursable activities. As such, the RMTS is conducted quarterly to capture how staff, also known as TSPs, spend their time during the workday to better understand the proportion of staff's time that qualifies as Medicaid reimbursable activities. Each quarter, certain staff are randomly selected to receive a 1-minute moment. When staff receive a 1-minute moment, all they need to do is describe what they're doing at that exact point in time. It is important to remember that the moment reflects only that single minute, and not everyone included in the RMTS will receive a moment every quarter. Once responses are submitted, Those moments are reviewed and coded as either reimbursable or non-reimbursable activities or services. This information ultimately supports cost allocation for both the LEA BOP and SMAW program, directly impacting LEA's federal reimbursements through the programs. The more moments that reflect LEA BOP covered services or SMAW activities, the more federal funding will be available for the LEA. Now that we have covered the basics of RMTS, let's review how RMTS financially impacts your LEA. As was mentioned in the previous slides, both programs reimburse LEAs for the cost of providing services to Medi-Cal enrolled students. RMTS results are used to identify the proportion of time that LEA staff spend on allowable direct medical service and administrative activities. Under LEA BOP, the results from the RMTS inform the direct medical service percentage, or DMSP, for all the LEAs in the region, which is applied to the annual cost report. Under SMAW, the results inform the RMTS percentages, which are applied to cost on the SMAW quarterly invoice. On this line, you see a graphic at the bottom that demonstrates the financial impact of RMTS. From left to right, participants shown by a group icon respond to a moment. Then the results of the responses inform the calculation of the DMSP for LEA BOP and RMTS percentages for SMAW, shown by a clock and pie chart icon in the middle. Finally, the DMSP and RMTS percentages are applied to the actual costs on the LEA BOP cost report and the SMAW invoice, which determines reimbursement amounts, as shown by a check icon on the right. Overall, for both programs, the RMTS plays a key role. Strong participation in responding to RMTS moments with clear, accurate responses will help ensure that your LEA's reimbursable is accurate, compliant, and fully supported. It is also important to note that your TSP's responses contribute to your LEA's moment response rate, which must be at least 85% to stay in compliance with RMTS. If there is no response from TSPs, this may lower your percentage. Now let's go over the TSP list, an essential component of RMTS administration. This slide contains two icons. One is a practitioner with a stethoscope to represent participant pool 1, and the other is a person working on a laptop icon to represent participant pool 2. Although the full phrase is participant pool, please note that we will be referring to them as pool 1 or pool 2. An LEA's TSP list includes all eligible staff that potentially perform direct services to students or Medicaid-related administrative activities in the upcoming quarter. If the LEA has a practitioner that is eligible and expected to potentially deliver Medicaid-covered services, putting them on the TSP list will allow the LEA to claim costs under either the LEA BOP or SMAW program. Staff who are fully funded may not be included on a TSP list. Who should be on your TSP list if your LEA plans to claim their costs through LEA BOP or SMAW? And how do we differentiate TSPs across the two pools? Let's break it down. Pool 1 is for directly employed LEA staff who perform direct medical services. Contracted staff that perform direct medical services should not be included. And for Pool 2, it is for staff who perform activities that support the administration of Medicaid. Directly employed LEA staff or contractors that fully participate in SMAW may be included on the Pool 2 list. Please keep in mind, a TSP cannot be listed for both pools for the same quarter. However, you can move a TSP from one pool to another for a different quarter. Before we start talking about what makes a response effective, let's take a moment to understand how RMTS impacts your LEA. RMTS results are used to identify, measure, and allocate the proportion of time that LEA staff spend on allowable Medicaid administrative and direct service activities. The RMTS impacts your LEA since it is a key component in the payment methodology for both LEA BOP and the SMA program. The results of the RMTS are applied against actual costs to help determine each LEA's federal reimbursement amount. Participation in RMTS ensures that your region can meet compliance requirements that are part of California's approved plan. Compliance with the plan is needed to maintain school-based Medicaid funding and will also assist your LEA in being audit ready. Now I will pass it on to Trung.
Thank you, Phoebe. In this section, we will go through the best practices for moment responses. Before we dive into best practices, let's go through the purpose of moments and what the TSP will be asked to report at that day and time of their moments. So each RMTS moment is simply asking TSP to pause and describe exactly what they were doing at one specific minute in time. The goal is not to evaluate performance or judge productivity, but to clearly understand the activity that occurred during that moment and whether it may be reimbursable under Medicaid. When a TSP receives a moment, the questions are designed to capture enough detail so the activity can be accurately reviewed and coded. That is why the focus is on the three key elements: who, what, and why. The who help identify who was involved or impacted by the activity, such as a student, parents, provider, or whether the task was completed independently. The what explains the exact activity that was taking place during that 1 minute snapshot. This should reflect a single specific task, not multiple activities or general job duties. The why provide the context or purpose of the activities. This is especially important because it helps determine whether the activities support the Medicaid program, such as providing an LEA BOP coverage service that is related to a care plan. Providing a clear and complete answer to these questions allows reviewers to accurately understand the activity without having to guess or follow up. When TSP describes the activity at the time of their moment, it helps ensure the activity is properly represented in RMTS results. Before we walk through the individual RMTS moment questions, it is important to understand why moments matter and how. Ultimately, they connect to reimbursement for LEAs. The graphic on this slide depicts a flow process, the survey icon on the left representing the moment response, followed by an arrow to an icon of a person at a laptop representing the activity being coded, another arrow to a calendar icon representing claimable time, and finally an arrow to a dollar sign representing funding. Each RMTS moment captures what an individual staff member was doing at an exact moment in time, and those responses are later reviewed and assigned an activity code based on CMS guidance. These activity codes determine whether the moment is reimbursable or non-reimbursable to LEA BOP and SMA, as well as federal reimbursements. Once the RMTS percentage and the DMSP under LEA BOP are calculated, they are applied to the LEA actual cost. This is how moment responses ultimately translate into federal reimbursements. Claimable time is represented by the DMSP or RMTS percentages. When responses lack sufficient detail, the moment may be coded as non-billable, which can reduce the overall claim amount. Clear, accurate, detailed, and complete responses help ensure moments are coded correctly and consistently. To stay in compliance with RMTS, LEAs are required to have an 85% moment response rate every quarter. The 85% response rate is compliance test that ensure that at least 85% of moment receive a valid response. For example, a response from a TSP within the required response timeframe is considered valid. An 85% response rate that help ensure that RMTS results accurately reflect the activity of the entire population being surveyed. The response rate is calculated at an accurate level across both participant pools. However, DSCS analysis showed that Pool 2 TSP respond at a lower rate, which can negatively affect the overall response rate and place the LEA at risk of non-compliance. It is important to emphasize that TSP who respond late or do not respond at all directly reduce the LEA valid response rate. Late and missing responses lower the proportions of valid moments, which impact compliance and can jeopardize RMTS statistical validity. LEA should proactively encourage and support TSP to respond to moments on time to ensure they meet the 85% requirement of each quarter. Now, let's look at the actual question in the RMTS. As noted earlier, RMTS moment questions are designed to capture the activity occur at the selected 1 minute in time. The questions are intentionally structured to help reviewers clearly understand the activity and its purpose without having to make assumptions. When a TSP click on the link to respond to their moment, the first question they will be asked is whether they were working at the time of their moment. If the answer is no, they will select from several options to help explain why they were not working. Maybe the TSP was taking time off, or the moment occurred before or after a scheduled workday. If the TSP is not working, there is no need to respond to any additional questions. However, if the TSP knows that they were working at the time of their moment, they will be asked 3 questions requiring a narrative response. These include, who were you with? Here, the TSP should not identify anyone by name, but should provide context as to who they were working with. For example, a student, a colleague, a parent, or no one if you were alone. What were you doing? For these questions, the TSP will describe the primary focus of their activity. If they are performing a health-related activity, the TSP should indicate what type of service or treatment. For example, if I was in the middle of a speech therapy section where we focusing on the letter S and R, why were you performing activity? Here, the TSP will provide detail on the reason they were doing the activity. If the reason for the activity is related to an IEP or other type of care plan, the TSP should note that information here. For example, the speech therapy service is part of the student IEP. Together, these questions help provide the context needed to understand the purpose of activity and whether it supports the Medicaid program. For Pool 1 TSPs, there is an additional question that is important as it helps with coding and determine if the TSP is conducting a billable direct service activity at the time of the moment. For the speech therapy response that we were just talked through, the answer to the post question should be yes, because the TSP identified that the speech service was part of the student IEP. If a moment response does not include enough information to clearly identify the activity or its purpose, up to 2 clarifying questions or CQs may be asked. Providing clear, detailed responses up front can often prevent the need for CQs. Lastly, on this slide is an important reminder. In order for a moment to be classified as a reimbursable moment that will contribute to LEA BOP or ESMA funding, the response must clearly support that the activity relates to a reimbursable Medicaid service. If there is not enough detail to support a reimbursable Medicaid service, the moment will be coded to a non-reimbursable activity. This slide walks through the basic step of the RMTS moment response process and what to expect from start to finish. First, the TSP will receive a notification that they have been selected for a moment. This notification is sent 1 student attendance day before the moment occurs, so the TSP knows ahead of time that response will be required. Next, when the moment, date, and time occur, the TSP should continue their work as usual. There is nothing special that a TSP needs to do exactly in a minute other than performing their normal job duties. So after the moment occur, the TSP will need to submit their response within the grace period, currently 4 student attendance day. In some cases, if the original response does not include enough detail, the TSP may receive 1 or 2 CQs. If this happens, the TSP should provide as much detail as possible to clear up any confusions. CQs are simply an opportunity to add mission context or provide clarifications so the activity can be fully understood. Responding to both moment and any CQs accurately and on time help ensure the TSP work is properly represented and support correct coding and reimbursement for the LEA. Now that we talked through the general moment response process, we're going to move on to highlight some tips and creating an effective moment response. In this section, we will talk through what constitutes an effective moment response. CMS has released guidance on best practices for complete moment response. As shown on the slides, they have created the acronym POINTS to promote and identify responses that are thorough enough to adequately support coding decisions. Let's break down the point from a TSP perspective. P, primary focus. What was the primary topic or focus of the TSP activity? O, objective. Why was the TSP completing this activity? I, insight. Did the TSP provide insight for the activity that they were performing? N. Necessary details. Did the TSP provide an appropriate level of detail in their moment response? T. For timely. Did the TSP respond in the appropriate time frame allowed? As a TSP, using the point framework helps you confidently respond to moments, reduces the likelihood of clarifying questions, and support accurate coding and reimbursement for your LEA. A good moment response is clear, descriptive, focused, and will demonstrate whether the activity was in support of Medicaid reimbursable service. At the top of the slides, you see a moment response from a TSP and will evaluate whether the response gets to the point. Pre-questions response, yes. Who were you with? No one. I was by myself. What were you doing? I was documenting 30 minutes of pragmatic speech therapy service for a student. Why were you performing activity? The purpose of documentation for speech service is to record the activity required to implement the student IEP. So the first component of the POINT acronym relates to identifying the primary focus of the activity. This moment clearly identified the primary focus as documenting services. Next, the moment detailed the objective of the activity. In this case, the TSP clearly included why they were completing the activity to implement the student IEP. The moment also provides sufficient insight on the activity by sharing that this was documentation of speech therapy service. They even specify the type of speech therapy by noting it was a pragmatic speech therapy services. Fourth, the moment response includes the necessary detail required to understand the activity, or N. The participant clearly paints a picture of what they were doing, who they were with, and why they were doing the specific activity at the time of the moment. Additionally, the moment is not overly descriptive. Instead, only the necessary information required for the reviewer to gather a clear understanding of the activity is relayed, appropriately excluding extra detail or personally identifiable information. Lastly, this moment was submitted timely, which is the T in points. While timeliness cannot be determined based on the content of the moment, the link to complete the moment will expire after the grace period elapsed. The RMTS software system will hold the date and time of the moment and the response so that DACS could prove that the response was submitted timely, if needed. As you can gather from the slides, if a participant does not ensure that their moment gets to the point, it can pose challenges for the reviewer to sufficiently review and understand the moment to be coded appropriately. On this slides, we are displaying another way that you can think about ensuring a moment gets to the point. We have broken down the important component of a narrative response to help determine if a TSP has complete information for an effective response. When reviewing the narrative response of a moment, it can often be helpful to take all information and answer to the narrative questions and look at it as a singular sentence. This can help you see all the important information conveyed in a single place to help determine if there is an adequate information. A TSP response should include a complete response clearly identifies the action that was taking place. This means describing the specific task being performed and your role in the activity, rather than using general or broad terms. Some questions to ask yourself to identify the actions. Does the response detail the specific action that was occurring? Does the response clearly detail the TSP roles in the actions? During the actions, the response should also identify the recipient of the actions or who the activities was for. This helps clarify who was impacted by the work being done, such as students, group of students, or the program more broadly. Some questions to identify the recipient. Does the response clearly detail who was receiving the actions? Does the response detail all parties directly impacted by the actions? And finally, the response should include the reason or context for the activity, explaining why the activity was performed and whether it was related to a care plan, assessment, or service. Help show how the activity support the Medicaid program. Some questions to identify the reason or context of the activity. Does the response detail why the action was being taken? Was the action pursuant to an IEP, IFSP, or plan of care? In this example, The moment narrative was rewritten into a single sentence that identified the actions, recipient, and reason for the activity. The action was that the TSP was doing a categorization. The recipient who received the service was a student. And the reason or context of the TSP doing a categorization was because it was in their IEP and pursuant to a doctor's order. If their examples moment didn't include all the necessary informations, actions, recipient, and reason or context, then it required clarifying questions to the TSP to gather the missing components. Clarifying questions or CQs are open-ended questions that are posed to a TSP. Sometime after submitting a moment response, you may receive a CQs. A CQ is simply a follow-up request for additional information about the activity you describe in the moment. CQs are used when the original response does not include enough details to clearly understand what was happening during the moment and why the activity was being performed. Receiving a CQ does not mean the response was incorrect or that anything was done wrong. It just means more information is needed to fully capture the activity. If you receive a CQ, the TSP will have 5 student attendance days to respond. The goal when answering a CQ is to provide additional clarity about the same moment in time, not to introduce new activity or describe something that happened later. It is important to respond to a CQ thoughtfully and within the required time frame. Just like a moment responses, CQ responses should clearly explain the activity using complete sentences and enough detail to stand on their own. The best way to avoid CQs is to provide a complete response the first time by including the key components of a strong moment response: the action, the recipient of the actions, and the reason or context of the activity. When responses get to the point, CQs are often not needed. I'm going to hand off to Luke to talk more about strengthening moment response.
Thanks, Chung. For strengthening moment responses, we will first discuss a new change to the moment question asked to Pool 1 TSPs. Was the activity an assessment, screening, or a service included in a care plan, such as an IEP, IFSP, IHSP, 504 plan, etc.? Previously, this Pool 1 moment question was asked as an introductory pre-question. However, the answers often contradicted the TSP's narrative responses for the subsequent moment questions, as shown in the example below. As you can see in the example, the response to the pre-question and the response to the narrative are contradictory. The pre-question reason response indicates that the activity is not related to a student's IEP, IFSP, or other care plan. However, the narrative specifically calls out that the activity was related to a student with an IEP. If the activity described is linked to a student's IEP, IFSP, or care plan, then the pre-question response will be yes. Remember that even though this response is an activity that is happening outside of a direct service with a student, it is still an activity that is connected to a student with an IEP. This includes time before or after a service. Because of frequent misalignments between a TSP's Pool 1 question response and narrative response, this Pool 1 moment question will be asked at the end as a concluding post question after the narrative moment responses, effective July 1st, 2026. It is important to be cognizant of all your responses to questions before certifying. Make sure all important is accurate and aligned to reduce confusion or the need for clarifying questions. Since TSP responses directly impact your LEA's ability to receive federal funding, we will now go through these 5 common gaps that can be avoided, which will strengthen moment responses. Number 1, the response does not appropriately answer the question. 2, responses lack detail or context. 3, responses include multiple activities occurring at time of the moment. 4, responses include acronyms or internally used language. And 5, the TSP fails to respond by the deadline, which is currently 4 student attendance days. Next, we will go through poor responses for each gap and how they can be improved. Starting with gap number 1, the response does not appropriately answer the question. As you can see on this slide, the top example highlights the importance of sufficiently answering the question being asked. The ineffective response at the top to the question, "What were you doing?" In this case, the TSP simply noted that I was doing my job. This response provides no detail or insight into the actual activity occurring at the time of the moment, making it nearly impossible for anyone reviewing the moment to know what was happening. The response at the bottom is much more effective, clarifying the activity they are performing that is part of their job. A response does not need to be long to be effective. If the TSP concisely states exactly what they were doing, it keeps the response focused, which is the P in the POINT acronym. Gap number 2, the moment response lacks detail or context. On this slide, we see an example of a vague versus descriptive response. The top response of doing paperwork does not provide any context or detail as to what the paperwork was related to, which could help the reviewer understand the nature of the activity. The second example below is much more descriptive. In the response, they essentially are calling out that they are completing paperwork, but also provide detail as to what that paperwork is and why it is being completed. Next is gap number 3. The response includes multiple activities occurring at the time of the moment. This is a common error. When a participant provides detail on multiple activities when responding to the what you are doing question. As we can see in the example, the individual reported that they were performing several distinct activities: monitoring readings for diabetic students, answering calls and emails, planning screenings and assessments, and documenting IEPs. However, it is unclear what activity the TSP was performing during their 1-minute sample moment. In this case, the participant will receive a clarifying question requesting detail to narrow down the activity that was completed at the time of their moment. In the second response, the TSP clearly noted a singular activity. It is much easier to determine how that moment would be coded by using the "who were you with" and "why were you performing the activity" narrative responses. This example highlights the importance of remembering that the moment is a snapshot of 1 minute in time. Therefore, it is important to focus the response on the specific activity for that 1 minute. Now on to gap number 4, which has to do with responses that include acronyms. Acronyms and shorthand language may be familiar internally, but it might not be known to the person reviewing the moment. Take the time to write out the full phrase instead of using acronyms. In the top response, you see 2 acronyms, CFT and JPD. The revised response removes the acronyms so that the person coding the moment has the information on the type of meeting and the department that was involved in the meeting. Responses should be written so that anyone externally can clearly understand the activity without additional explanation. And finally, gap number 5 is failing to respond timely. Once the grace period after the moment date and time has passed, the TSP can no longer respond to the moment. This means that even if the TSP was doing a Medicaid reimbursable activity, it cannot count towards RMTS quarterly results. Non-responses can hurt the overall results and can impact the sample being statistically valid. DHCS has approval to run the RMTS and use the results to help allocate the LEA's costs to Medicaid. If the RMTS fails to meet statistical validity, the ability to use the results comes into question. It is important to work with TSPs so that they understand their participation is important and impacts the LEA's funding. Also, please note that the response period is subject to change July 1st, 2026. Now that we've reviewed the common gaps, let's focus on best practices to support an effective response. First, submit your response as soon as possible after you receive your moment. If you can't respond immediately, jot down what you were doing at the assigned time so that you can recall details and submit your moment later. Obviously, trying to remember what you were doing for 1 minute snapshot in time when 24 hours have passed can be a challenge, so respond or make notes as quickly as possible. Next, use complete sentences. Writing in full sentences helps clearly communicate what was happening during the moment and reduces the chance that your response could be misinterpreted or need follow-up. Following that, let's focus on describing the singular activity that was occurring at the moment. Even if the TSP is juggling multiple tasks that day, the response should reflect only the activity conducted during the specific 1 minute snapshot. Providing enough detail is key. Clear descriptions help reviewers understand the activity without needing additional clarification. Taking an extra moment to explain what you were doing and why the activity was being performed can often prevent clarifying questions later. As we mentioned in the previous slide, it is important to avoid acronyms unless they are spelled out in one portion of the response. Responses should be written so that someone outside your organization could understand the activity without additional context. Finally, remember not to include names or any student identifying information. Descriptions should focus on the activity and its purpose while protecting privacy. Following these best practices helps ensure responses are clear, complete, and easy to understand. TSPs need to be trained on the importance of providing clear, detailed moment responses since the quality of those responses directly impacts compliance, coding accuracy, and reimbursement for the LEA. To help your TSPs succeed and ensure your LEA remains compliant, the point framework can help guide TSPs in writing responses that are clear, complete, and supportable. This gives staff a consistent structure to follow and helps reduce clarifying questions while improving coding accuracy. Review past moment responses to identify common errors or trends. Looking for patterns in vague responses, misaligned pre-questions, or missed deadlines can help pinpoint where additional support is needed. This information can then be used to tailor trainings to address specific gaps rather than providing general reminders. Finally, refer your TSPs to the RMTS Quick Reference Guide as an ongoing resource they can use when responding to moments. This guide has FAQs and includes examples of insufficient responses and suggestions for improvement. Let's wrap up this section with a few key takeaways to keep in mind when responding to RMTS moments. For staff completing moments, the most important reminder is to use the point framework as a guide. Taking a moment to clearly describe the primary activity, explain the purpose, provide enough context, and submit responses on time helps ensure your work is accurately captured and understood. It is also important to maintain any supporting documentation related to your activity when needed. While documentation is not submitted with the moment, having it available supports audit readiness. Timely responses matter. Responding to moments within 4 student attendance days and to clarifying questions within 5 student attendance days helps avoid delays, reduces follow-up, and ensures your activity can be reviewed and coded appropriately. For RMTS coordinators, success relies on collaboration. Working closely with the RMTS administrative unit, fiscal teams, and practitioners helps ensure everyone understands expectations and stays aligned. Monitoring response trends can also help identify where additional training or support may be needed. The slide bubble icons on the left indicate that we'll pause for a knowledge check before moving on to the next topic. What is not a best practice for a good moment response? A. Provide detail on why you are doing the moment. B. Focus on the singular activity performed at the moment. C. Exclude any identifying information, such as student and colleague names. Or D. Use acronyms so that your response is short. And the answer is D. You should refrain from using acronyms. Remember, the person reading the response may not know what the acronym stands for. In that case, you will get a clarifying question. So take the time up front to type out the phrase so that you won't have to respond to an additional question later. I will now hand it over to Trung for the next section.
Thank you, Luke. We are now going to transition into our next major topic, Audit-Ready RMTS documentations. In this section, we'll walk through the documentation expectations under the updated TSIP, what LEAs and RMTS AU must maintain, and why this documentation is essential. As we begin, let's talk why documentation matters. Documentation is an important component of the RMTS process and essential for program compliance. As we discussed in the last sections, narrative responses should be detailed enough so that an independent person can understand what the TSP was doing and why they were doing the activity at the time of their moment. When responses are not detailed, federal OIG auditors have asked for supporting documentations. In these audits, when documentation could not be produced, the moments were disallowed. Documentation served 3 purposes. First, it supports the code that was assigned to the moments. Second, being able to provide supporting documentations uphold the integrity of the time study. And finally, it protects the LEA if there were to be a federal audits. So as we move through the next slides, keep in mind that the goal is to make your documentation audit ready at any point during the year. The bottom corner of this slide shows a checklist icon. When we say documentation must be audit ready, we mean 3 things. It must be accurate, meaning it clearly supports the activity described in the moment response. Available, meaning you can quickly produce it if requested. Aligned, meaning the documentation support Medicaid reimbursable work. In other words, documentation must clearly justify how the moment was coded and should already exist from the time the activity occurred as part of normal LEA processes and record keeping. Now, we move on to LEA documentation that are split into 2 categories. For direct service moments, documentation may include a student care plan, authorization of services, date of service documentations, signed clinical notes and treatment logs, practitioner licensures, certifications and qualifications, practitioner schedules and payroll records, contracts with medical providers, and a copy of service claim to DACS if applicable. For administrative activity, the narrative response serves as the primary documentation and needs to be thorough enough to confirm the activity performed at the time of their moments. In addition to the narrative response, LEA must maintain PTO documentations. LEA can also provide additional optional documentation that could help further support a moment such as Medicaid outreach, flyers, referrals, calendars, emails, meeting notes indicating Medicaid policy developments. To stay audit ready, LEA should adopt some helpful best practices. These include gathering documentation as you go instead of waiting until an audit and trying to pull documents together. Moments are only for 1 minute of time, so it is far easier to document at the time of the moments versus having to recall what you were doing after the moments. And remember, some federal audits take place years after the date of service, when staff may no longer work at the LEA, so get in the habit now of maintaining documentations. Organizing files by quarter, then TSP, then moment code, and maintaining a folder for quarterly coding reports or QCR certification and supporting items, training TSPs annually and offering refresher section mid-year, and encouraging staff to use calendars, notes, and emails to reinforce their moment narrative. Good habits up front lead to fewer issues later. Before we move on, here are the key takeaways from these sections. RMTS documentation is essential for claiming Medicaid funding. Strong documentation protects your LEA during audits. Direct service moment requires specific, detailed support and the form of care plans, progress notes, and student attendance records. Reimbursable administrative moments must show through the response and documentation that the activities support Medicaid covered services. And finally, if a moment response lacks details, it cannot be coded to a Medicaid reimbursable activity. No assumptions can be made when coding moment 2, so TSPs must provide enough details in their response to support a Medicaid reimbursable activity if the moment will receive a reimbursable activity code. The slide chat bubble icon on the left indicates that we will pause for a knowledge check before moving on to the next topic. This is your opportunity to test your understanding of documentation requirement we just covered. Which statement is true about RMTS documentations? A. LEAs must upload documentation into the RMTS system software platform when responding to a moment. B. Moments do not require documentations. C. LEAs must keep documentation for reimbursable moments and provide it upon request. D. Documentation is only needed if the TSP receives clarifying questions on their moment response. Great, thank you everyone for participating. I've seen a lot of correct answer. You are correct. The answer is C. LEA must keep documentation for reimbursable moments and provide it upon request. Option A is incorrect because LEA are not required to upload documentation into an RMTS system. LEA should maintain documentation in their files. And remember, Code 2A documentation will likely contain personally identifiable information and should be securely stored. Option B is incorrect because Moment 2 require documentations such as Code 2A direct service moments and paid time off moments. Option D is incorrect because documentation is not limited to moments that receive a CQs. Some moments without a CQ still require documentations, and some CQ moment may be coded as non-billable and therefore do not require supporting documentations. Again, documentation must be maintained and available, even though it doesn't need to be uploaded at the time of certifications or tied only to certain codes. Now that we have wrapped up the documentation knowledge check, we'll move on to the next sections.
Thank you, Chung. In this section, we will go over documentation requirements for moment responses for both direct services and administrative activities. CMS has put out a tip sheet on federal documentation requirements for claims, cost reporting, and time studies for LEAs. Here, and on the next 3 slides, you will see a table reflecting the CMS tip sheet listing additional supplemental documentation for audit support. The table consists of check marks identifying which supplemental documentation to support the billing of a Medicaid direct medical service claim and/or to support a time study for a direct medical or administrative service activity per CMS guidance. In this slide, we have school attendance records for the dates of service on the claim, prior authorizations, medical plans of care, provider agreements, medical provider qualifications associated with licensing or certification, and evidence of provider licensure or certification, and enrollees' medical records. All of the documentation listed on this slide can be additional documentation to support the billing of a Medicaid direct medical service claim and can also possibly be used for administrative activities. Meanwhile, the only supporting documentation to support a time study on this slide are school attendance records, medical provider qualifications for licensing or certification, and an enrollee's medical records. Continuing with the list of additional documentation for audit support per CMS guidance, we have the following. Documentation of the service performed on the date of service, such as service and diagnostic codes, start and finish time of the service, including clinical notes signed and dated by the provider, including service claims, transportation logs, payroll records associated with school personnel providing services, copies of contracts with medical providers, and copy of the service claim submitted to the state Medicaid agency or managed care organization. As you can see on this slide, almost all of the documentation listed on this slide can be used to support both the billing of a Medicaid direct medical service claim and a time study for a direct medical service or administrative activity, except for transportation logs. Transportation logs only have a check mark to support the billing of a Medicaid direct medical service claim. This slide lists IEP or Individualized Family Service Plan, IFSP, prescriptions or referrals for IEP services, and documentation regarding where the service was provided and who provided the service. For CMS guidance, all 3 of these documentation can be used to support the billing of a Medicaid direct medical service claim and a time study for a direct medical service or administrative activity. Wrapping up the table documentation list reflecting the CMS tip sheet, we have the following: cost reports, time study source documents, sign-in sheets from training sessions, copies of any manuals related to the time study, cost allocation plan, CAP, and procedures associated with Medicaid SBS reimbursement. And finally, national provider identification of the LEA or provider. As you may notice, all of the documentation on this slide can be used to support a time study for a direct medical service or administrative activity. However, per CMS guidance, they may not support the billing of a Medicaid direct medical service claim. It is important to take note of these documentations discussed in these past 4 slides, as they are helpful to support claims, cost reporting, and/or time studies. Now that we have additional supplemental documentation for audit support for CMS guidance, let's dive into more detail on supporting documentation for a direct medical service or administrative activity, starting off with direct medical service activities. It is important to remember what type of documentation is needed is highly dependent on the details of the moment's activity. So, first, let's go over the various types of documentation that can be used to support a reimbursable direct service moment, which is coded as a 2A moment. To help with determining what is needed for documentation, review the responses in the moment narrative. For example, if the TSP was conducting an initial assessment, a copy of the assessment would help support this moment. The TSP may also have a calendar entry that blocks their time for the assessment, and possibly a copy of the assessment report. These pieces of documentation would all help to support the specific moment response. Documentation to support direct service moments may include IEP, IFSP, care plans such as IHSP to support the service. This is often a required document to bill for LEA BOP treatment services. However, assessments or screenings may not have a care plan. Authorization for services, which are required to provide treatment, screenings, and assessments. Initial assessments, even if they did not result in a care plan. This would be required documentation when the moment response indicates that the TSP was conducting an initial assessment and the student did not have an established care plan. Documentation of the service on the date claimed, such as progress notes, service logs, start and end times, etc. This is required documentation when the moment response indicates that the TSP was providing a direct service included in the care plan. This slide depicts an image of a folder with a magnifying glass, which leads us to go over some common direct service documentation errors and federal audit findings. One of the most common issues that federal audits highlight are around missing or incomplete documentation. This includes situations where 1. Key documents such as IEP, IFSP, IHSP, or other care plan associated with the service are missing or not maintained as supporting documentation for a moment. 2. When the authorization for services is missing, or where there is no record that the authorization for a service was provided by a qualified practitioner. 3. Where detail of a service are lacking through missing or insufficient progress notes or service logs. In some cases, this could mean that while the notes exist, they do not clearly describe the nature and extent of the service provided, or are missing the appropriate sign-off of a qualified practitioner or supervisor when required. In general, it is important that notes clearly describe the service encounter in detail, including information regarding what was done and why, the units of service, for example, how much time was spent with the student, or how much food or medication was administered, etc., student progress or response to the service, and next steps. Additionally, all notes and logs should be appropriately signed by a qualified practitioner or supervisor when required. Ensuring all required signatures are present helps verify that the service was provided by an appropriately qualified practitioner. So now that we have discussed documentation requirements and best practices, over the next few slides we will review a few examples of direct service moment responses and the documentation that could be maintained to support the coding that the direct services are reimbursable services. Here we have an example of a moment response by a physical therapist in Pool 1. Following that, you'll see some examples of possible direct service documentation that could support the moment response. First, TSPs in Pool 1 are always asked, was this activity related to an assessment or screening, or related to a service that is authorized in an IEP, IFSP, or other service or care plan? For this moment, the TSP answered yes. Then the TSP is asked the following questions. Who are you with? This TSP answered that they were with a student. What were you doing? This TSP answered that they were in a therapy session. Why were you doing this? This TSP was performing the therapy session as the student's IEP required physical therapy services twice a week. In this example, the TSP is performing a Medicaid-covered treatment service pursuant to a care plan. To support this particular response, let's walk through some possible documentation that the TSP can maintain as proof that the moment is a reimbursable direct service if audited. The student's IEP. The IEP can provide proof that the therapy session is medically necessary for the student. Progress notes with date of service and detail of session. Progress notes can support that services indicated in the IEP were provided on the day of the moment. TSP's calendar showing they were in a therapy session during the assigned moment. The calendar entry can support what the TSP was doing at the time of the moment. The attendance records that support the student was at the school on the day of the moment. Attendance records can help prove the IEP student was at school and could participate in the therapy session. As you can see in this example, each piece of supporting documentation helps provide proof that this moment was an eligible direct service. You will also notice that majority of these supporting pieces are included in the list from the CMS tip sheet we discussed earlier. Here we have an example of a moment by a credentialed school psychologist in Pool 1, and possible direct service documentation for their moment response. Similar to the last example, in this case, the TSP answered yes in response to the pre-question, indicating that the activity at the time of their moment was related to an assessment, screening, or care plan. Then when asked, "Who were you with?" the TSP answered that they were alone. "What were you doing?" the TSP answered they were writing a report. "Why were you doing this?" the TSP detailed that they were summarizing assessment results in preparation for an upcoming IEP meeting. It is important to understand that summarizing assessment results is considered an extension of the direct medical service, such as for example, the assessment. To support this moment, let's walk through some possible items that the TSP can maintain. The student's assessment results, the resulting assessment report that the TSP is writing, the student's IEP. Please note, if an IEP wasn't established, the TSP may want to keep record that documents that the IEP was not yet established or was never established. Calendar entries related to holding time for writing the report and the upcoming IEP meeting. Here we have an example of a moment response by a licensed speech-language pathologist in Pool 1, and possible direct service documentation for their moment response. This TSP answered yes to the pre-question. Then when asked, "Who were you with?" they answered that they were alone. "What were you doing?" They explained that they were preparing an activity for an upcoming session. "Why were you doing this?" They detailed that the student's IEP requires therapy twice a week. This moment is focused on a pre-service activity for a Medicaid-covered treatment service that is pursuant to an IEP. Reimbursable direct care services encompass all pre- and post-service time directly related to providing the service, even when the student is not present. This includes time related to preparing for a service, completing paperwork related to the service, preparing progress and session notes, traveling to or from a treatment session, or completing billing activities related to the service. To support this moment, some possible documentation to support this that the TSP can maintain may include the student's IEP that details they should have speech therapy twice a week, any progress or session notes of the session that include the date of service and provide detail on the session, TSP's calendar showing they were preparing for the session at the time of the moment, and the upcoming session with the student. And finally, here we have an example of a moment response by a credentialed school psychologist in Pool 1, and possible direct service documentation for the moment response. In response to the pre-question, the TSP answered yes. Then when asked, "Who were you with?" they answered that they were with the student. "What were you doing?" They answered that they were conducting an assessment. "Why were you doing this?" They detailed that they were doing the activity due to a triennial evaluation. As you likely also notice, this moment response is relatively vague and does not provide much detail. Supporting documentation becomes especially important for this moment to clearly describe that the moment aligns with the direct service. To support this particular moment, examples of appropriate documentation include the student's IEP, which can verify psychology services and triennial assessment timeline, the resulting assessment and/or report showing the activity was related to psychology services, attendance records indicating that the student was present at school on the date of the moment. The possible pieces of documentation we discussed in each of the 4 examples are all good to have to support the direct service moments. We encourage LEAs to maintain strong documentation to support that their direct service moments are reimbursable with reference to the CMS documentation tip sheet. Let's wrap up this section on documentation with a few key takeaways. First, administrative activity moment narrative responses may serve as the supporting documentation for the moment. If needed, LEAs may also choose to maintain additional documentation to support the reimbursable coding of administrative moments. Second, Code 2A moment responses must be supported by clear and complete documentation. This includes items such as the IEP, IFSP, care plan, authorizations, assessments, and progress notes or service logs. Third, strong documentation clearly describes the nature and extent of the service, including specifics like start and end times and details of the service provided. Fourth, missing, incomplete, or vague documentation, lack of required signatures, or services not reflected in a care plan may increase the risk of adverse findings during an audit. And lastly, Strong documentation equals stronger audit readiness, regardless of if the documentation is for administrative activities or direct services. Maintaining strong supporting documentation for moments assigned reimbursable codes can help LEAs support coding and federal funding during the instance of an audit. The slide chat bubble icons on the bottom left indicate that we'll pause for a knowledge check before moving on to the next topic. At the top of the screen, you'll see a moment response from a licensed occupational therapist. For the pre-question, you'll see that they answered yes. Who were they with? They were with a student. What were you doing? They were in a session on fine motor skills. And why were you doing this? The student's IEP requires this assistance. What types of documentation could be maintained to support this moment? On this slide, you will see some supporting documents that could be maintained to support the moment. 1. The student's IEP documenting the need for occupational therapy services. 2. Any authorizations for OT services for the student, which in this case could be a written prescription for a physician, dentist, or podiatrist. 3. Signed progress notes or service logs for the therapy session, including the nature, extent, or units of service provided on the date of the moment. 4. The TSP's calendar entry for the scheduled session's date and time. 5. And lastly, school attendance records confirming the student was in school the day of the service. These items can all further strengthen support for the coding of a moment. Thank you again for participating. I will now hand it over to Edgar for our next section.
Thank you, Leilani. Hi, everyone. My name is Edgar Dominguez. I'm an analyst with the ESPA program. Now we will move on to specific documentation tied to administrative moments, which any participant pool 1 or 2 can provide. We want to emphasize that for administrative moments, the narrator's response can serve as the primary documentation source if it is a detailed enough response. During an audit, if it is determined that the moment response is not detailed enough and it happens to be coded to a billable activity, LEAs may need to substantiate that moment with supporting documentation. Because of this, DHCS encourages LEAs to work with their TSPs to ensure that they respond to their moments in a detailed and robust manner while avoiding the use of any personal information, such as names. Again, this is new guidance that DHCS is providing to LEAs when it comes to administrative activity moments in regards to supporting documentation. The main point is that the primary piece of documentation for administrative activities can be the RMTS moment itself. That is, if it is detailed enough. Under new guidance, the expectation is that the TSP's narrative should be as detailed as possible, clearly indicating who was involved, what activity was occurring, and why it was occurring, because a more detailed moment provides stronger support for coding. In addition to the narrative response, LEAs may maintain supplementary documentation to further support the coding of a reimbursable activity code, particularly when additional clarity may be needed for audit purposes. Examples include Medicaid outreach materials, referral documentation, emails, meeting notes, any policy development materials, or calendar entries of scheduled appointments or work tasks that help explain and provide clarity on what the TSP was doing at the time of the moment. Unlike other administrative moments, however, it is required that all paid time off, or PTO, is supported by LEA records of the TSP's PTO. Now that we've covered documentation requirements and best practices, the next few slides will show examples of administrative activity moment responses and the types of documentation that could be maintained to support coding these administrative activities as reimbursable services. Here we have an example of administrative activity documentation for a director of student services. Who was the TSP with? They answered that they were on a phone with a non-public agency. What were they doing? The TSP answered that they were arranging transportation for a student to and from the non-public agency. Why were they doing this? The TSP was fulfilling district responsibilities for the student's IEP. This is one of those moment responses that hits all the main points, but could benefit from a little bit more detail. The TSP tells us they were coordinating with a non-public agency, but does not clarify what type of service the student receives there, or whether the transportation was for a medical related service. Adding just a little more information, such as identifying the type of service being provided, for example, speech therapy, OT, or other medically related services required by the IEP, helps reviewers understand whether the activity supports a Medicaid reimbursable activity rather than a general educational service. To support this moment, examples of possible documentation include the student's IEP, calendar entries, and/or referral for Medicaid services. Here we have an example of administrative activity documentation for a special education teacher. Who was the TSP with? They answered that they were with teachers. What were they doing? They were in a staff meeting. Why were they doing this? Because administration was providing recent updates. This is an example of a moment response that is lacking in detail, since we don't know what kind of updates were being presented in the staff meeting. The narrative tells us who was there, but not what the actual administrative updates were. A CQ would be asked to help identify what was being discussed at the staff meeting at that exact moment. When TSPs describe their administrative activities, they must include enough detail so reviewers can determine whether the activity was related to general school activities or to a Medicaid-related administrative activity. For example, if this staff meeting included discussion on Medicaid outreach, referrals, service coordination, or anything connected to Medicaid-covered services, the TSP should state that clearly in their narrative. In these cases, supporting documentation such as meeting notes, calendar entries, and/or Medicaid outreach materials may be requested during an audit. If the meeting was purely school-related regarding topics such as upcoming events, testing schedules, school operations, then the moment would be coded as a general school activity and no additional supporting documentation is required beyond the narrative. This level of detail helps ensure accurate coding and reduces audit risk. As a note, while clarifying questions can be asked when needed, the best way to avoid being asked any CQs is for TSPs to provide clear, detailed information in their responses. Here we have an example of administrative activity documentation for a school social worker. Who was the TSP with? The TSP answered they were with school counselors and admin. What were they doing? They were attending a weekly PLC meeting. Why were they doing this? They were collaborating of student services. Here the TSP names who they were with and the type of meeting, but the narrative still lacks essential detail because it only states that the TSP was in a PLC meeting discussing student services. As a reminder, acronyms such as PLC should be spelled out or defined. However, even if the acronym is fully spelled out, the name alone does not explain what was actually being discussed. The narrative should describe the specific topic of the meeting and the nature of the services discussed. Without this information, it cannot be determined whether the activity was related to Medicaid-covered tasks or general school operations, so a CQ would be needed to gather more detail. Moment responses are strongest when written in clear, plain language, as if explaining the activity to someone outside of the education field, where workplace-specific acronyms may not be understood. To support this moment, examples of possible documentation could include meeting notes and/or calendar entries. Here is the final example of administrative activity documentation for a special education coordinator. This moment response provides a strong amount of detail for each of the pre-questions. Who was the TSP with? They answered they were in a meeting with a vendor that provides aid for students. What were they doing? The TSP answered they discussed about a student who required medical eligible health services through an aid. Why were they doing this? The TSP was ensuring students were provided appropriate healthcare services. To support this moment, examples of possible documentation can include referrals for Medicaid services, if the phone call pertained to a referral with the vendor, meeting notes, calendar entries, and/or emails. All right. Now for some key takeaways. First, thorough documentation is essential. Proper documentation ensures your LEA receives the funding for administrative activities. For administrative moments, the documentation should clearly support the activities described in the moment. This includes a detailed narrative with spelled out acronyms, Medicaid outreach materials or flyers, referrals for Medicaid services, emails, and/or meeting notes. And finally, more documentation equals stronger audit readiness. As you can see on this slide, there are once again a couple of chat bubble icons indicating we'll be pausing once again for a quick knowledge check. There is a question on this slide. A counselor receives a moment while they are speaking with a parent over the phone regarding the student's recent challenges at school. The counselor provides guidance and assists the parent in coordinating with the school and the student's therapist. What are some ideas for documentation that could support this moment? On this slide, you will see some correct answers. To support this moment, here are some examples of indirect documentation that the TSP can maintain. Detailed narrative, a reminder, a detailed response, narrative response itself can serve as a documentation for the moment. Meeting notes, emails to staff, therapist, and their parent, calendar entry supporting the meeting, referral for mental health services. Please note that this is not an exhaustive list, just a few examples that could apply. But the main point of this section is to work with your TSPs to help them respond to moments with enough details so that the responses are considered the supporting documentation that is needed. If there is not enough detail in the responses and it is coded to a billable activity, the LEA needs to ensure that they have the supporting documentation to help substantiate the activity being billed under Medicaid. Thank you everyone for participating. I will now hand it over to Lacey for our next section.
Thank you, Edgar. All right, so now we will talk through the LEA coordinator's review of the coded moments using the quarterly coding report, or QCR. You will see in the following slides that the QCR is a great tool that provides insight on how TSPs are responding to moments so they can better manage their TSP lists. But before we dive into that, let's start by discussing the LEA RMTS coordinator. The visual on this slide represents who the LEA RMTS coordinator at your LEA might be. One image shows a person who is wearing 3 hats, and the other shows 3 separate people to represent how the coordinator roles might be organized at your LEA. The LEA RMTS coordinator is the person that supports the administration of the RMTS for their LEA for either or both the LEA BOP and SMA program. This person may have a different title, such as District SMA Coordinator, LEA Coordinator, or something similar. It is important to note that the LEA RMTS coordinator might be the same person that coordinates both the LEA BOP and the SMA program, or it could be a separate person. The important part is that this person is responsible for supporting the administration of the RMTS for your LEA. Now that we understand the LEA RMTS coordinator's role, let's talk through one of their key tasks, the review of the LEA's coded moments on the quarterly coding report, or QCR. So what is the quarterly coding report? Before we talk through some of the policy changes, let's define the quarterly coding report, or QCR, and the new form that will go with it. The QCR itself is a LEA-specific report generated by the RMTS administrative unit, including all the sampled moments in the quarter and each moment's assigned activity code. As part of the new policy effective July 1st, 2026, DHCS will provide a standardized QCR coding and documentation certification form available to use each quarter. So what is this form for? The form will be used by the LEA coordinators to certify that the LEA maintains supporting documentation for moments per DHCS requirements. We'll also certify that the LEA agrees with the codes assigned to each moment. And the form will be incorporated into the quarterly coding report. I just want to take a moment here to assure you that the new form is not administratively burdensome, as it is just a simple form that helps LEAs be prepared to provide supporting documentation in the case of an audit and confirm that they agree with the assigned codes. Okay, so let's talk more about the QCR and why it matters. The quarterly coding report serves as a tool for LEA RMTS coordinators to examine their TSP responses and how those responses were coded. It can be used to verify the accuracy of their coding and can be used as an opportunity to gather documentation to support moment responses. It can also be used as a resource to review TSP responses to better manage their TSP lists. For example, If most of the TSP's moments appear to be more educational than Medicaid related, then they may want to consider removing them. When a LEA certifies the activity codes on the quarterly coding report are correct, then they are indicating that they have the appropriate documentation to support the moments for their TSPs and that they agree with the coding assigned to each moment. Essentially, the LEA is confirming that it possesses the necessary documentation to validate the moments recorded for its TSPs if asked, and that the assigned codes accurately reflect those activities. Having documentation that supports moments can help LEAs prevent costs from being disallowed during audits and keep more federal dollars. In short, the QCR safeguards compliance, accountability, and funding for LEAs. RMTS administrative units will have 30 calendar days after the close of the quarter to assign activity codes for all moments for the quarter. So 30 calendar days after the quarter ends, all moments will need to be assigned a code. Once all moments are coded, the administrative units must provide the QCR to their participating LEAs, detailing the assigned code for each LEA's moments. The units will share the QCR with the LEA with all coded moments. Then, the RMTS administrative units must work with LEAs to resolve any coding disputes before the QCR can be certified. This step is important in the certification process. Signed QCRs must be submitted by the RMTS administrative unit to DHCS upon request. So again, the administrative unit will complete the coding of moments within 30 days, provide QCRs to the LEAs, resolve disagreements within 30 days after the LEA's review, and ensure signed copies are ready for submission when needed. And now we will move on to the LEA's responsibilities. The icons on this slide are a thumbs up for agreement, a question mark for correction requests, and a check mark for documentation. Once the QCR is shared, LEAs have 30 calendar days to review it carefully. At that point, they have two options. They can certify that they agree with the QCR, or if something doesn't look right, submit a coding correction request to their RMTS administrative unit. And here's a critical reminder. LEAs must gather and keep documentation to support the code 2A moments for their TSPs. For reimbursable administrative activity codes, LEAs may choose to maintain additional documentation beyond the detailed moment narrative if necessary. Effective starting quarter 1, which is July through September 2026, the LEA will receive a new form, the Coding and Documentation Certification Form, from the administrative unit each quarter. After the LEA reviews the QCR and finalizes any correction requests, the Coding and Documentation Certification Form will be certified by the LEA RMTS coordinator. As mentioned previously, the LEA will receive the QCR and certification form 30 days after the codes are finalized. The LEA will then have 30 days to review the QCR, allowing time for the LEA RMTS coordinator to review codes, gather supporting documentation, and request any changes that they can support. Documentation is required to support moments. For questions regarding documentation, we held a general and code 2A documentation training in September, which is now posted on our website, and we encourage everyone to take the time to review that as well. It is not required to provide documentation at the time of signing the certification, but by signing the certification form, the LEA is indicating that they have the appropriate documentation to support the moments for its TSPs. A physical audit binder is not required. Documentation may be maintained in physical or electronic form and should be available upon request by federal or state Medicaid oversight agencies. And now that we have covered the RMTS administrative unit and LEA RMTS coordinator responsibilities, let's talk through the coding correction review process. If there is no request for corrections, the LEA certifies the QCR. But if the LEA disagrees with coding detailed on the QCR, the administrative unit has 30 calendar days to review coding correction requests and make updates if appropriate. It is important to note that just because an LEA submits a coding correction request, it does not mean that the RMTS administrative unit must make an update. If there is a request for corrections and the RMTS administrative unit and LEA do not agree on a correction within 30 days, a coding decision may be elevated to DHCS through a coding appeal. LEAs do have the right to appeal the code for any moment, not just 2Z moments. This ensures that there's a clear path for resolution and that decisions are made in a timely manner. The important takeaway here is that the LEA's 30-day QCR review window is critical, as it is the time frame that everything will need to take place, including the correcting, certifying, and/or escalating if needed. Okay, so now let's talk about the coding appeals process. Appeals are rarely needed, but when one is needed, it is submitted by the administrative unit on behalf of the LEA. So the LEA doesn't handle that piece directly, but they do have the right to appeal any Moments code. While the appeal is pending, the LEA will not certify the QCR. Certification only happens after everything is resolved. If an appeal is submitted, DHCS steps in to review the situation. DHCS requests the reason for the correction and may request supporting documentation to evaluate the appeal. This is why it is important to keep supporting documentation accessible. Once all the information is provided, DHCS evaluates the case and then provides a decision. DHCS issues a written decision within 60 business days of receiving the appeal request. Although it may not take the full 60 days, the timeline is important as it gives everyone a clear expectation. Finally, once the appeal is resolved and any coding changes are updated, the LEA RMTS coordinator certifies the QCR and the process is complete. Although the appeals process adds extra time, it does ensure accuracy and fairness in coding decisions when the moment is especially difficult to code. Okay, so now let's walk through this visual of a timeline as an example of how the timing could go for Q2, which runs from October 1st to December 31st. The first blue dot marks the end of Q2, which is December 31st. No more moments are sampled for Q2 after this date. However, TSPs may be asked a clarifying question in which they have 15 days to respond. The next blue circle shows when the RMTS administrative unit completes their coding, which is by January 30th. This is 30 days from the end of Q2. Then the LEA reviews those coded moments during the month of February and certifies or requests corrections to the RMTS administrative unit by March 1st, as you see with the blue circle in the middle. This is 30 calendar days from when the RMTS administrative unit has completed the QCR. By March 31st, which is 30 days from the LEA's review, the RMTS administrative unit resolves any disagreements with the LEA, and then the QCR is certified. If there is not any resolution, the RMTS administrative unit sends an appeal to DHCS. DHCS will review and provide a response no later than June 26th, as you can see on the last blue circle. This is up to 60 business days from the appeal request. The timelines could vary if the LEA or the RMTS administrative unit uses less time in their review, but this is an example and it illustrates the maximum time that is allowed for the QCR review process. All right, now for some key takeaways. LEAs will have 30 calendar days to review the QCR. During that time, they'll need to either confirm the agreement or send any coding correction requests back to their administrative unit. LEAs should also make sure they keep documentation to support moments for TSPs. To standardize this process, a new QCR coding and documentation certification form will be available for the administrative units to provide to the LEAs in fiscal year 26-27. This form helps LEA RMTS coordinators confirm that documentation is available to support moments and that the LEA agrees with the final coding. And again, just a reminder that if the LEA will appeal code assignments to DHCS, the RMTS coordinator will not sign the QCR coding and documentation certification form until there is a written resolution. And you'll see on this slide that the chat bubble icons indicating that we'll be pausing for our knowledge check before moving on to the next topic. So the question is, starting with the July to September 2026 quarter, which of the following statements about the QCR process is true? A, LEAs have 60 business days to review and certify the QCR. B, LEAs must certify the QCR and submit the coding and documentation certification form after reviewing and resolving any corrections. Or C, documentation for Code 2A moments must be submitted at the time of certification. The correct answer is B, which I saw a lot of B's come through. Thank you. LEAs must certify the QCR and submit the coding and documentation certification form after reviewing and resolving any corrections. It's important to note that the documentation does not need to be submitted at the time of certification, but it must be readily available upon request for audits. This step ensures compliance and audit readiness, which is a key focus of the new TSIP requirements. Here's why the others don't work. Option A states that 60 business days is allowed for certifying the QCR. This is incorrect. LEAs have 30 calendar days to review and certify the QCR if there are no coding correction requests. And then option C stated that you must submit documentation when certifying, but that is not required. LEAs do not submit supporting documentation to the RMTS administrative unit. LEAs just need to keep moment documentation on file in case of an audit. So the big takeaway, review thoroughly, certify after corrections, and maintain documentations for compliance. Thank you all so much, and I will now pass it to Leilani to wrap us up.
Thank you, Lacey. Before we wrap up and hop to the next steps, we are going to pause and take a moment to answer a few questions verbally.
Thank you, Leilani. Hi, everybody. Sarah Borkowski, LEA Provider Relations Manager, wanting to address some of the concerns that we see in the chat, specifically tied to documentation and how to tie a moment response back to documentation when PII and PHI is not allowed in the moment. So with that, well, first of all, for Code 2A, yes, you definitely need supporting documentation. On the administrative side, the narrative response needs to be detailed enough to support what a TSP is doing during that moment in time. For some reason, the narrative response is not detailed enough, then at that point, it may require supporting documentation to support a billable code. But 100% Code 2A needs that supporting documentation. With that, it's up to the LEA in regards to how you want to gather that information and what system you set up internally. It may be something where as you have your TSPs doing their moment responses, that you're starting to gather those is when that you see that the moment response is tied to a direct service, and you start gathering it at that time. During the quarterly coding report review, and you see that the LECs have coded it as a 2A, then that might be a good time to start putting together your documentation so you have that ready. Again, it's not something you need to supply at the time of certifying that the quarterly coding report, the documentation is available. And please do not send that to the LECs or try to upload it through the SSP. And in the event of an audit, it'll only be asked for from DHCS or by CMS. So we don't want you uploading anything with PII or PHI to any of the system software platforms. So that would be like PCG and Fairbanks. And then with that, Tara, did you want to add anything from the administrative side for ESMA?
Yeah, so we'll go ahead and drop it in the chat in response to Maria's question. So for administrative possible to RMTS moment documentation, again, it needs to be just detailed enough. If there is a question and we go back to a date and time, supporting documentation may be a calendar entry, an email, a meeting note. And again, paid time off PTO is also required documentation. So that would be it from the ESMA side.
Okay, thanks, Tara. And then I do see a question from Kelly in regards to how long does CMS have to audit each year? Generally, the timeline is within 7 years, but CMS can extend that if they believe it's tied to fraud, waste, and abuse. Other part of that is reminding you all about LEA BOP's PPA. We did extend the documentation requirements to 10 years, which is aligning ourselves with the Medi-Cal requirements as a whole that DHCS has. So just flagging that. Let's see. Okay. If anybody has any other questions, I think that addressed, because I know there was a lot of overall concerns in regards to documentation. Also, I do know a lot of billing vendors do provide RMTS support, so you may want to contact your point of contact there to see if that is something that they can help you with as well, or if they have any type of tracking system built into their platform.
Thank you, Sarah and Tara. Let's recap what we covered today in the next couple of slides. Let's go over some key compliance takeaways mentioned throughout today's session. First, participating in RMTS is required for LEA BOP and ESMA. As a reminder, RMTS results are a key component in the payment methodology that determines your LEA's funding for both programs. It is important to actively participate in RMTS and stay in compliance with RMTS requirements, such as the development of the quarterly TSP list, maintaining high response rates, and identifying documentation that can support moment responses. Second, TSPs must respond to moments timely with the required time frame. These responses must reflect a 1-minute snapshot and contain detailed information. This includes the TSP describing who they were with, what they were doing, and why they were doing that activity. Effective moment responses helps with accurate coding and prevents the need for clarifying questions. Train TSPs to get to the point. Third, multiple types of documentation are required, including supporting documentation for reimbursable moments, your LEA's quarterly TSP list, the TSP calendars and schedules, and the QCR. All of these documentation must be accurate, aligned with Medicaid reimbursable activities, and readily available for audits to protect and strengthen your LEA's funding. Finally, the QCR must be reviewed and certified by LEAs. Now let's discuss LEA responsibilities and best practices. Once again, LEAs must participate in RMTS when enrolled in LEA BOP and/or ESMA. It is important to work closely with your RMTS administrative unit for direction to stay in compliance with the various aspects of RMTS, including the quarterly timelines. LEAs should provide ongoing training and support to their TSPs. TSPs should be encouraged to respond right after their moment has passed to help reach the response rates for a valid sample. In addition, use the point framework to help TSPs write effective responses for accurately coded moments. LEAs must maintain Audit-Ready documentation for RMTS, including all reimbursable activities. The documentation focus is on direct medical services, Code 2A, but that does not mean that your LEA would not be asked to provide supporting documentation related to another type of reimbursable moment, especially one where the moment response was not detailed enough to support a reimbursable activity code. A best practice is to keep documentation organized and updated throughout each quarter and as moments occur. Last but not least, LEAs are required to review and certify the QCR within 30 days. LEAs must certify agreement with the QCR or submit coding correct requests to the RMTS administrative unit. Make sure your LEA has supporting documentation available during this time. On this slide, you'll find LEA BOP resources to help support your LEA with the program. Don't forget to subscribe to the LEA BOP listserv using the link provided at the bottom of this slide. This ensures you receive updates, reminders, and future training materials regarding the program. On this slide, we have included key resources in relation to RMTS and ESMA. You'll also find a link to a published draft of California's TSIP that was submitted to CMS and is currently pending approval. If DHCS could not get to your questions today, please email us at rmts@dhcs.ca.gov. This concludes our April 2026 quarterly meeting. On behalf of the LEA BOP and ESMA teams, thank you all so much for attending today. We appreciate your time and ongoing partnership in supporting student health throughout California. Your feedback is important in how we develop future trainings. Please take a moment to complete our feedback survey. You may use the QR code on that screen or the link in the chat to submit your thoughts. Thank you again for your time today and have a great rest of your day.